So I want to break down. You said like initially when you, and first of all, I hate that you always are like, like you are an amazing surgeon. I've had the privilege of being able to work alongside you and see you over the past year. You're a phenomenal surgeon. I mean, I see you do, I try to emulate a lot of what you do. So I don't want you to keep saying this. This, for everyone listening, this is a fallacy that he's propagating, that he's not. I mean, you are just as good of a surgeon, as Bill. Your outcomes are phenomenal. The patients are just as happy. Like, you're a great surgeon. I really feel blessed to have been able to work with you and learn so much from you. But going back to like what you were talking about early on in residency, the pressure of surgery, how did you deal with that? What were your attendings thinking when you were like anxious or nervous or, having to vomit or puke or take some time to kind of compose yourself?
So I will say that it was not something that was necessarily public knowledge per se, because I didn't want it to be out there. Oh my God, I'm having so much struggle, stuff like that. I was married at the time. My wife definitely knew the challenges I was dealing with. But one thing that I did that helped me out was basically doing a lot of practice surgery. At the time, it was very easy to get cadaver eyeballs. And in fact, I would go ahead and actually get cadaver eyeballs and basically go ahead and practice doing surgery on the cadaver eyeball itself. Now, we didn't have these nice little things to kind of hold the eyeball in place, stuff like that. So after you were shouting loud cry, she actually would come into the OR and she'd actually hold the eyeball while I'm going ahead and doing stuff. So sort of us bonding together inside there. In fact, the funniest story is that I would sometimes get these little cadavers or be in these little microscopic jars, and I'd kind of bring them home, and they'd be like a certain area in the refrigerator or something like that. And then one time we had a relative that come. My father-in-law actually came to visit us, and he opened up the refrigerator and he was like, oh my God. And after that, he never opened up the refrigerator again, because he was like, oh my God, I don't know what I'm going to find over here. But side story here. But I think what it comes down to is just being confident enough that no matter how difficult it is, that if you put forth the effort, you will be able to get through that. I mean, one of my favorite sayings is, I hope I get this right, but hard work beats talent when talent fails to work hard. And ultimately, I do feel that I'm a good surgeon at this point in time. I always try to be humble. I'd rather let other people say, like I literally, last week, I had 2 patients while I was operating saying, oh, I heard that you're the best. I heard you're the best. I'm just basically telling them that I don't know who's telling you this or whatever, but no, everything is great, whatever like that. But it's one of those things that I think as long as you're humble and just don't take things for granted, I think a lot of us just make it seem like we're like amazing stuff out there. But I think it's important to understand that ultimately these are patients that are depending upon you, and you want to go ahead and do your best for that patient. But when you go ahead and work through that, I think you start to basic maneuvers like even just simple as a capsulorhexis. I mean, we go through it and it seems really easy, but that maneuver it takes a while to kind of get all the vectors down and why you're pulling in this direction and that direction. I can't tell you how many times as a resident, I'd start pulling and my rhexis would go around the wrong side or this side or that side. I mean, I had way too many. In fact, a true story, like during my fellowship, I actually got pulled off of doing cataract surgery for 2 or 3 months just because I was having so many challenging cases at that point in time. And my preceptor was like, hey, we just can't have you it's not, I mean, and again, it was more me than anything else. But I think the key is even when you go through these ruts where a lot of us will go through these times where you have like maybe 2 or 3 tough cases, just now you kind of have to sit back. And I think videotaping is really critical. We have that access that we can sit back, analyze. I think the fact that we've got access to YouTube videos, phenomenal, because now we can go ahead and anytime you have a challenging case, difficult case, you can kind of look and mentally prepare. And I think a lot of it is just kind of going through all the steps, trying to think in your mind, okay, well, this is where I'm going through that. And paying attention to a lot of details in the sense that I think where engineering has helped me out is to try to understand, why did I do what I did? And is there any way where I have wasted steps? The goal in my mind is not necessarily to be a fast surgeon, but more to be an efficient surgeon, meaning speed will come naturally. You don't have to work towards fast. But if you make sure that you don't waste steps and try to understand why you did what you did, then I think you gradually evolve towards where you're going to be inside there. And so there's definitely, volume definitely helps. I mean, I look at yourself and where you are right now at the end of your fellowship versus at the very beginning. You start off being a good surgeon, but definitely through volume, through experience, I mean, you yourself can probably see how much more confident you are in being able to handle different things and things of that nature. And I think there's definitely something we said to when you go through this whole stream of volume. I mean, I really feel like a fellowship like this, you almost get like 5 years worth of experience condensed into 1 year, where you can come out and just get everything off the bat.
Part of being a good surgeon is having the confidence to be able to handle sort of whatever's thrown at you. And if there is a complication, knowing how to handle that, how to get through that. Every cataract surgeon's worst fear is breaking the bag or having a tear in the posterior capsule. But if handled appropriately, if you maintain the proper pressure dynamics between the anterior and posterior segment, a lot of times the patient will still see really great and not have any issues if it's handled appropriately.